Here's a daunting statistic. Smokers are 15 to 30 times more likely to develop lung cancer than non-smokers. The upside? Early detection dramatically increases lung cancer's cure rate. We're learning all about screening today on Across the Fence. Hello, Vermont. Here are some more statistics, and these are a little shocking. Breast and prostate cancers are roughly 3 times more common than lung cancer, but lung cancer kills about twice as many women as breast and colon cancer combined, and about twice as many men as prostate and colon cancer combined. What's the big difference? It's not the disease, it's not a difference in treatment protocols, it's that people are far more likely to get screened for breast, prostate, and colon cancers than they are for lung cancer. My guest today wants to change that. Dr. Beth Zigmund is a diagnostic radiologist with the UVM Health Network who specializes in imaging of the chest, heart, and lungs. She's also a member of the UVM Cancer Center, where she directs the lung screening program. Dr. Zigmund, welcome.
Thank you.
I'm very glad to have you here with me today. Learn more about this. So statistics are scary. Those are some big numbers, big figures. So let's start with some good news. How survivable is lung cancer when it is detected early? Because this actually was shocking to me.
It is remarkable.
Yeah.
So if it's detected at what we refer to as an early stage, which means that it hasn't spread to surrounding lymph nodes or other organs,
parts of the body.
The 5-year, we usually look at the 5-year survival rate. The 5-year survival rate is about 65%.
Yeah, that's really, that's a good number.
It's a very good number.
Right.
And there was actually a more recent study where they looked at the earliest group of patients who were screened in the very, very long ago trial, and they looked at the patients who had been diagnosed early and managed to survive, and those patients had a survival rate of about 20 years. The patients who were diagnosed early. So we know that if you catch it early, your treatment course will be less aggressive, and your survival, your chances of cure are much, much higher.
Right. Well, and this seems to be the paradigm that we're moving into with cancers in general, that when we have good screening methods and when people are getting screened, we can find them earlier, and when we find them earlier, we just have better outcomes.
That's exactly right.
Yeah. Okay, good. So why is screening so effective for lung cancer?
So
what is the screening like?
The test that we use is, it's called a CT scan, or a computed tomography scan. And what that does, and the technology has obviously gotten a lot better over the years, but we can see things that are really, really, really small in the lungs. So we can see things that are a 1/16 of an inch or less, So
this is even much more precise than like an X-ray.
Oh, much more precise than an X-ray.
Okay.
Oh, yes.
Yeah.
X-rays are not precise. X-rays are super important, but they don't have that kind of precision, not even close. So we can see, we get like a volumetric, images of the lung, where we can find these very tiny, what people often call spots on the lung. We call them nodules, and they're very, very small, and we can see lymph nodes, we can see all kinds of tissues on a CT scan.
And this is what you do all day?
This is what we do all day, yeah.
So you look at these scans, and then that is, and you're just looking for little telltale spots, the markers that indicate that this is a possibility that this would be cancer.
Exactly.
And then what happens after that? What comes after, if spots are seen, you've seen something, you've seen some nodules on the CT scan, then what happens?
Yeah, no, that's a great question. So most of them are not important. Most people have them. Actually, you and I probably have them.
Oh, okay.
Even if we never smoked, right? So they're very, very common, but we can see signs that tell us that maybe this one is a little bit more important. For example, if it's a little bigger than the others, if it's got some, the borders look a little funny to us. There are lots of, and these
features,
are, when I say look a little funny, there are very specific criteria that we use. I want people to think that, and then we follow those a little more closely to see if they grow, or if we see one that we know is a cancer, then we plug that person into a plan right away.
Yeah.
So
and what's the difference in survival rate if lung cancer is detected after it has spread?
It depends on how much it has spread. It depends on how far it's spread. If it's just in the same part of the lung, if it goes to the nearby lymph nodes, if it goes to other organs. But if a person has what we call an advanced stage cancer where it's spread to other organs, the survival is dramatically lower. It's less than 10% at 5 years compared to 64, 65% for people who are diagnosed with.
That's a big difference. 64 to 65 down to 5.
10,
5 to 10,
9% is
Oof. Okay.
it's roughly 9%, 10%.
Yeah.
Yeah.
Right. Okay.
Yeah.
And so who is most likely or more likely to develop lung cancer? Because there's a very strong correlation here. We talked about, we hinted at it when we did our opener. It's like, guess what it's going to be? But yes. So who is most likely to get lung cancer?
Yeah. Unfortunately, people who smoke are most likely to get lung cancer, or who have a history of smoking. So
recent history, can it be far in the past history? Does it make a difference?
It makes a difference, but anyone whose lungs have seen cigarette smoke is at a higher risk than a person who has never smoked cigarettes. It depends on a number of factors. It depends on when you quit, how much you smoked, for how many years you smoked. And then there are other factors that come into play too that are very specific to the particular person.
Okay.
Yeah.
And actually, does it matter if you were, say, a pack-a-day smoker or an occasional smoker, if it was 20 years ago, 10 years ago, et cetera, in terms of your eligibility for screening? Because you do have to have a history of smoking, correct, in order to be able to get screened for lung cancer?
Correct. You have to. Yeah, that's a super important question, and I'll lay it out, but I don't want your viewers to remember these numbers.
Okay.
And I'll explain why, because it's complicated. It's not like breast cancer screening where you just, if you're a certain age, you get screened for breast cancer. If you're a man, you're a certain age, you get screened for prostate cancer. And
lung cancer, you have to have with your PCP the conversation that establishes your eligibility for the screening.
Yeah.
You can't just go book an appointment.
Yeah, exactly.
Okay.
So to be eligible for a lung cancer screening test, you have to be 50 years old or older. You have to have, if you're a smoker, then you have to have smoked what we call 20 pack years worth of cigarettes, which means a pack year is you smoked roughly a pack a day for a year.
Okay.
So if you did that for 20 years, then you're eligible. And that creates all kinds of problems because, smoking it's a moving target. People are not, sometimes they quit for a little while and they start again. So the bottom line is if you feel like you've smoked a lot of cigarettes, I would recommend speaking to your provider about whether or not you're eligible for screening. So there's that. And then if you stopped smoking, if you quit smoking, then you may still be eligible, which is really important. So I want people to know that if you used to smoke and you stopped, you're still at risk and you may still be eligible for a screening. So if you stopped within 15 years, you're still eligible for screening.
Okay. So it sounds like the bottom line is if you have a history of smoking, especially a significant amount of smoking, good idea to have that conversation with your provider, talk about your eligibility for screening, see if you can go ahead and get screened.
Yes, I couldn't have said it better myself. Yeah.
Okay.
Exactly.
Well, and then what happens during a screening? I mean, we saw it a little bit. There's the CT scan. You go into a tube. Is this a very invasive test? Is it fast?
Oh, wow. No, this is, this is the thing. It's the easiest screening test out there.
Okay.
No needles.
On behalf of women who've had mammograms, I'm going to agree with you.
Yes.
Yes.
Yes. So no needles, no medications. In a lot of cases, you don't even have to change your clothes. I mean, some places may ask you to put a gown on. You just, the what we call the CT technologist, the person who's actually doing the mechanics of the scan, will help you get onto the table. And it's not the scary long tube magnetic resonance imaging MRI machine. This is a donut, so it's a very thin. It's not even a tube; it's just a donut. You get on the table, and it literally takes 3 to 5 seconds to do the scan. So your whole experience is, there's some time in the waiting room, but the scan itself is just.
And how about insurance coverage? Because I can imagine that might be another barrier for folks. They're like, I don't have time for an expensive test, et cetera.
Yeah, that's a very important question, and I know a lot of folks are worried about the financial strain of having another test, and maybe if they find something, you have to have additional testing. So the actual screening test itself is covered. It was under the Affordable Care Act. It's a preventive study, so it needs to be covered in full.
Okay.
So there shouldn't even be a copay. If your insurance is asking you for a copay, then I would take that up with the insurance company.
So then, beyond fear factor, there's not a lot of reasons, I mean, the fear of what happens if, there's not a lot of reasons to not have that conversation with your PCP. Go ahead, see if you can get in on the screening. And I have a question about that too. How many people are getting these screenings who are eligible for screenings? Do people tend to be responsive or no?
Unfortunately, that's why we're here, right? Because most people who are eligible do not get screened, and there's a whole load of reasons why people don't get screened. But in Vermont, only about 1 in 4 people who are eligible actually get the screening study. So it's a really, really large number of people who we may be missing these cancers in that can be cured.
Do you have to come to Burlington, or like to a health center in Burlington? No. Okay, so available in communities all over Vermont.
All over Vermont. Not even, there are hospitals outside the University of Vermont Health Network, which is what I belong to. There are sites in New York. If you have viewers in New York, in upstate New York, we have several sites in New York. So there are lots and lots of places that are doing the test.
Okay.
Yeah.
Removing those barriers. I hear that? The barriers have fallen away. Go and get your screening. Talk to your PCP. Last question. What is the most effective way to prevent lung cancer?
The most effective way to prevent lung cancer is to not smoke cigarettes.
Yeah, there's no safe amount of smoking, is there?
No safe, and it's not just a risk factor for lung cancer. It's a risk factor for multiple other cancers and poor lung health. So it's not just that it might kill you. Yeah, it might make your life really miserable. Right. To live with these other diseases and the damage that it does to your lungs. So don't start smoking.
Don't
and if
start
you
smoking.
Smoke, it's really hard to quit. I acknowledge that people have a lot of trouble quitting, but there are tools out there. So, have that conversation with your provider.
Okay. Well, let's follow up. So we've done our best to tackle a lot of information in a too short amount of time. So for more resources from the UVM Cancer Center about lung cancer and lung cancer screenings, check out the links and QR code on your screen. Dr. Zigmund, thank you so much. Important conversation today. Oh, absolutely. My pleasure.
Yeah, thanks so much.
As always, Vermont, thank you for learning and exploring with me today, and thanks to the team that makes Across the Fence possible. I'm Amy Finley. This is Across the Fence. Come back and let's learn and explore again tomorrow.